Good afternoon, and thank you for joining us for today's daily media briefing on COVID-19 with London City Mayor Ed Holder, Medical Officer of Health for the Middlesex-London Health Unit, Dr. Chris Mackie, and today we are also joined by the Warden of Middlesex County, Cathy Burghardt-Jesson. Just a reminder that the briefing will continue until 2:30, and there's an opportunity for the media watching to submit their questions, and I would like to remind them if you could just indicate your name and your media outlet with your questions. And again, a welcome to the viewers who are tuning in on Rogers Television, online on Rogers Facebook and YouTube, and also tuning in on radio with Global News Radio, AM 980 CFPL in London. Well, let's get the briefing going, and I will now turn it over to the Warden of Middlesex County, Cathy Burghardt-Jesson.
Great. Thank you very much, Jan, for that. I certainly appreciate being part of this discussion. It's been, I guess, about 10 days or so since I last met with you or was part of the discussion, and I've been able to catch some of the briefings. I'll be honest, not all of them. And I think this is great information to be getting out to all of our residents as it becomes, things change and are updated daily. So I appreciate the opportunity to be part of this today. And with that, Aaron.
Well, thanks very much, Cathy. Firstly, and from the top, to Dr. Mackie and the Middlesex-London Health Unit, thanks. I think what you're doing matters, and the messaging that we've consistently said over the last number of days going through this, and Cathy and I certainly were part of that, is that whole issue around health and self-distancing. But Dr. Mackie, your folks are stellar. They care like hell, and we really appreciate it. So thank you. Two quick items, if I can talk about today. One is we've had some concerns expressed in terms of our downtown, Old East Village, Richmond Row, about increased criminal activity, particularly in terms of things like break and enters and smashed windows and loitering during this COVID-19 pandemic. So as part of that response and as part of our core area action plan implementation, what we've done is we've asked the police, and they have responded very positively in terms of police patrolling, but they have asked us that if you as merchants, if you as individuals see anything suspicious, let them know. As the police have said many times, if we don't know, we can't go. And so that's the message that they're giving us. So we're asking Londoners and those that visit our city from Middlesex County, we hope, be our extra eyes, report all the crimes because we're in it together. Second quick point is we've had a number of questions because London is the city of festivals, not to be confused with the festival city. And so the question then becomes, what's going to happen over the late spring and early summer with regard to festivals and events? You think of the things that we do. We've got Sunfest, Rock the Park, Ribfest, 3-on-3 basketball, the Labatt Park Majors baseball team, even things like Jeans and Classics and the Grand and those kinds of things where there are crowds typically. At this stage, no decision has been made. But we also recognize that there's a need for our festival organizers to have some certainty so they can get on with their worlds, as well as to those folks who attended and have attended and plan to attend these events. First priority has to always ever be everyone's safety, and we're evaluating the options. What we're going to be doing is we're having a broad discussion on Monday with event organizers, with senior city staff to come up with some determinations and some recommendations. And again, I think it's a bit of a moving target. Dr. Mackie may well has some thoughts that we're certainly one mind, though, that until we know what we know, then we err on the side of caution to do the right thing. So knowing all of that, I'll be able to report back better, we hope, next week in terms of some of the outcomes of those discussions as well. So with that, Dr. Mackie, may I turn it to you with sincerest thanks for what your team does.
That's very kind of you. Thank you, Mr. Mayor. Your leadership is important as well, and Madam Warden for joining us today. We have a number of reporting issues that we want to raise today. First of all, the high-level numbers, 514 cases across the province, only 8 new cases in the Middlesex and London region. Both of those numbers are aligned with the slowly flattening curve We definitely are still at a relatively high level of disease activity, but that curve seems to be flattening. Total number of cases now that have been diagnosed in Middlesex and London is 258 with 14 deaths. That's 3 new deaths over the past 24 hours. We're also reporting now long-term care and retirement homes separately, as well as dividing out so that it's clear how many of those cases in long-term care homes and retirement homes are staff compared to how many are residents. That's all available on our website, healthunit.com, www.healthunit.com. Click through to the coronavirus page. 43 cases right now have been diagnosed in long-term care homes. That is really driving our new cases. Most new cases are coming from long-term care homes. Of those 43, 29 are residents and 14 are staff. In retirement homes, only 9 cases, 7 among residents and 2 among staff. Big pivot provincially that we talked about where the provincial healthcare system is moving towards supporting long-term care facilities in a really more intensive way. Major announcement last night that hospitals would no longer be allowed to transfer patients to long-term care homes in the current environment. So that's a big welcome change. The hospitals were sitting around 60% capacity, long-term care, at least in this area, around 99.5% capacity, and really quite stretched in the current environment. So great to see that hospitals are able to help the long-term care facilities to relieve some of that burden. The other thing that I wanted to bring to your attention today, we have done some analysis of the cases by lower tier municipality. This was a request that came from the Warden through the County Middlesex Emergency Control Group, which meets weekly at this point. And the request was to see how many cases there are in the County of Middlesex and how many of those cases are in which municipalities. I can report some of those numbers to you today. This is based on numbers from Monday, and at the time there have been 234 overall cases in the region, 211 of those in London. After London, Strathroy-Caradoc was the second largest number of cases in the Middlesex and London region. Strathroy-Caradoc had 14 cases, about 6% of the cases in the area. Middlesex Centre had 5 cases, about 2.1% of the cases in the area. And North Middlesex, Thames Centre, Adelaide, Metcalfe, Lucan, Badolph, Newbury, Southwest Middlesex, all less than 5 cases. We don't report specifically how many numbers when the case counts are less than 5, because it starts to approach identifying information. So London, 211, Strathroy-Caradoc, 14, 5 in Middlesex Centre, and then there were additional 4 cases in other municipalities in Middlesex. And that's all for me today, Dan, and I'm happy to take questions.
All right, very good. Thank you, Dr. Mackie, Warden Burghardt-Jesson, and Mayor Holder. We'll go to the media's questions. The first one, Mr. Mayor, is for you today, and it's from Steve Young at CTV London. Mayor Holder, you touched on this during the Police Services Board meeting this morning. Who is handling the calls relating to people not practicing social distancing? And how busy is the dedicated phone and email response line that the city has set up?
Thanks, Steve, for the question. What we've done is to alleviate some of the pressure on the 911 calls that our London police were receiving. City administration decided to set up its own phone line and a call-in center as well as through email. And typically on an average day, we're receiving a couple of hundred calls daily. What that has done in turn is it's made us think in terms of how we handle our bylaw enforcement. And to the point of this past long weekend, we served some roughly 35 charges, mostly to do with social interactions, playing on playground equipment, basketball courts, park settings, but not walking through, but simply congregating and being in areas that they should not be. we had of those a half a dozen charges that were related to businesses. So with that, one could look at it and say the rate of compliance is very good. But one thing that that the warden and the medical officer of health and I would absolutely insist on, and why did we do this in the first place? To try to encourage people to pay attention to self-distancing. It is so critically important. We want to be ahead of the curve, and we do not want the efforts of the last month to go in vain. So the city is the first place of refuge, if you will, for people to call in terms of the phone or the email address, and we'll make sure that that is up on the city's website, london.ca. But in addition to that, we are asking individuals to be vigilant for their sakes and for their family's sake and for their friends' sake.
All right. Thank you very much, Mr. Mayor. And Madam Warden, I wonder if maybe you could answer the same question. How are things going? I know the OPP is handling a lot of those calls in the county, but what are you hearing from the folks who are manning those lines and those emails?
Well, interestingly enough, yes, you are right, Dan, that the OPP is handling, for the most part, the policing of it. But from the lower tier perspective, bylaw enforcement is out as well. And they are patrolling parks, places where people normally congregate. And the approach that most of the lower tier municipalities has taken is an education approach. So if you see a group of whether they're youngsters or teenagers or even adults that seem to be congregating, it's education first, education first. And there really has not been a lot of pushback from that. The police, I don't have any up-to-date numbers from the OPP, but I do have one statistic to report, and that is from Strathroy. And the police did end up laying a charge against a local business owner due to the way that business was being operated. And that was after numerous warnings. So from our perspective, I think that people are appreciating the education standpoint, the education approach. A number of the lower municipalities, mine in particular, Luke and Biddulph, have set up email addresses that are there to answer any specific COVID-related questions, but also to act as a way of communicating concerns that might be seen. And we've certainly received a few emails, but the communication actually, I would have to say, is slow to come in. So, I agree with what the mayor has said. It's constant. We have to be constantly reminding people. We can't let up on that message of physical distancing. Dr. Mackie, the last couple of days has, been cautiously optimistic that perhaps maybe we're in that flattening of the curve territory, but we can't let up, because certainly this virus shows us that if we let up in any way, it's not going to stop. So I would certainly encourage our residents to continue the physical distancing, and as I say, our bylaw officers and the OPP will be there if need be.
Thank you very much, Madam Warden and Mr. Mayor, for those answers. We're going to go to the next question. Dr. Mackie, this one is for you, and it's from Dan Brown, who is from the London Free Press. Dr. Mackie, we were told to expect a surge of cases, but that hasn't been the reality in London and Middlesex. Hospitalizations and deaths still remain low. What accounts for this gap between what we were preparing for and this reality? And a further question, looking at those numbers, is there anything about them that hasn't panned out the way you expected?
Yes, thank you for the question, Stan. The part of the challenge when the surge of cases was being predicted was the inherent uncertainty of a brand new virus circulating. And what the virus is an interesting one in that it circulates the same way as influenza. So we've had case counts that not nearly as high actually as influenza, but in the same sort of ballpark. But it's got the severity of something more dangerous, like the SARS virus. And so it's that combination that was really concerning. We've been very very diligent here, and that has been a big part of the success. And we've also been fortunate, and that's been part of the success as well. Diligent in terms of early decisions to close schools, to implement, closure of businesses, strong physical distancing measures. All of those things made a huge difference early on, and it's why we're reaping the benefits now of a pandemic wave that's not as big as some models predicted. The other thing is that, we've talked about this whenever the issue of modeling has come up, that some of the models had inherent flaws that were very clearly never going to pan out. When you have a virus that in the entire world has never surpassed the number of cases that influenza causes a year in any country, and you're now, the models are predicting that it's going to be 80 times as significant in terms of case counts as influenza. There's something fundamentally flawed with the model. So modeling is, the most important part of modeling is that it helps you to understand how the policy changes will impact your epidemic. So you can model that, if we do nothing, we'll have a high level of cases. And if we do some things, this is how we predict the number of cases would change. And this is, if we take significant measures, this is how they would really flatten out. So that's the usefulness of modeling. It's more for decision making than actually predicting with accuracy what the case counts would be. That said, I think the healthcare system did absolutely the right thing by scaling up ICU ventilator capacity, making sure there was lots of space in the hospitals, which there still is, and that's great. And now we're shifting a bit. The next question was about one thing that might have been unexpected. So, we knew that long-term care homes and residential homes would be places where there would be significant outcomes and places where there are vulnerable people living. But the degree to which this has shifted from the community into long-term care, to a certain extent here in Middlesex and London, but much larger extent in some other parts of Ontario, that's been a real concern and is leading to some of the increase in death counts that you're seeing now.
All right. Thank you very much, Dr. Mackie. We've actually got a little spot. I know there's some questions still coming in, but as we wait for those, we've still got a few minutes left. And I thought it would be interesting for the folks who are tuning in, who themselves may be isolating at home or who may be in quarantine because they've either been exposed to someone or they've had some travel outside of the country. What are some of those things that you have done yourselves because you've been, working differently for sure, but also having connections with people? And I wonder, maybe, Mr. Mayor, we could start with you and then go to the warden and then to Dr. Mackie. What are some of the things that you've been doing to deal with, for lack of a better term, the reality we find ourselves in with this pandemic?
Well, Dan, I was actually one of those that was compelled to self-isolate by virtue of having been in the States for a family reunion, which didn't quite fully happen. But once I was there and came back, I was compelled to be in self-isolation for 2 weeks. It's interesting that finished two and a half weeks ago, it seems to me now, but it almost doesn't feel a lot different, except that one of the things I can do is I can do this interview in my office by myself. And so I've had to learn to be a little more technologically adept to be able to cope with that. But, it's one of the things that we've done in our council meetings is that we've insisted that, be it council or be it committees, that we've only had one representative council in the meeting along with the clerks and the technical person. So we keep groups no bigger than 5, incredibly well spaced apart. I'm the only representative when it comes to council, for council meetings, and the chair of the committee is the only person in the council chamber when it comes to that, and the rest of us come in and we zoom in remotely. Final point I would say is that I've probably, in some respects, never worked longer on the phones than I ever have as a result of this pandemic. But people have been really great to deal with that way. And then, of course, when you can use Zoom or Skype or some of the face-to-face things, which isn't quite as nice as seeing somebody person to person, but everybody gets it. They know what needs to be done, and so technology becomes your friend, and you respect and understand that. So that'd be some of my early comments.
And so I, like Ed, have found a different way, to conduct business and work with my fellow counselors and staff members, whether it's at Lucan or the county level. And, that's been interesting. And in some ways, I look at my calendar in January, and it was pretty full, and days were full of meetings. But when you can meet virtually, it almost seems like you've got more going on during the day, because you can pack everything on through a phone call or video conferencing. And quite often at the end of a workday, I feel almost more worn out than I did when I was actually going places and meeting with people that way. I certainly miss the social aspect. There's no question. I mean, I've known Ed a long time. He's a hugger. I'm a hugger. I miss that. I miss that ability to connect with somebody, personally. And, and I'm afraid that it's going to be a lot while longer before we're able to conduct business that way. Personally, I'm at home. I'm very fortunate where I live. I have a nice piece of property, so I'm able to enjoy the outdoors. Two of my 4 children are home. My children are older, so I'm past the homeschooling age. Thank goodness. But actually, as a family, we're interacting in a way that we haven't in quite some time. We're back to playing board games. We're, playing croquet outside or bocce ball. And these are things that, as my children in their, mid to late 20s, early 30s haven't wanted to do in some time. So as a family, learning to get to know each other in a different way. And so for that, it's positive. It's been a positive experience.
Great. So I think there was a question about the deaths that we reported, three new deaths in the last 24 hours. And the ages were 60s, 80s, and 90s. None of those deaths were associated with those residential home settings.
Okay, and that was a question that we received from Sawyer Bogdan at Global News Radio AM 980. We've got 2 more questions, and the first one for Dr. Mackie. This is from Steve Young at CTV News. London school boards are meeting tomorrow about what to do with the remaining school year. With the data you are seeing, do you think students should be returning to the classroom before the end of June?
So this is a great question. It's one that my kids ask me often. This would be a very difficult decision to make at this stage. Certainly, we can say that over the next several weeks, school closures will remain a crucial part of our public health measures and distancing measures. Beyond that, I think it's a bit early to say for sure. And you could certainly make the case for a precautionary decision here to keep the schools closed through to the end of the year. But it really, we also could see over the next 3 or 4 weeks the pandemic wave really start to settle, which might generate a different decision. But certainly with the amount of planning that it would take to reopen the schools at this point, it seems like it would be even just logistically a difficult thing to do.
And Dan, may I add something as well? And that is that we heard the Premier 2 days ago request and receive from Queen's Park Legislature an extension of an additional 28 days for their emergency measures. What that suggests is that schools will be certainly closed till, instead of some first few days of May now, till at least May 12th. I think it's becoming much more unlikely that that will happen, but I would say that put stronger emphasis on the homeschooling and the, when I say that, I'm talking about the homeschooling where the teachers are trying to interact with their students through various computers and apparatus, so that they'll be able to save their year. I think the Minister of Education and even locally, the director, the Thames Valley School Board director, was pretty clear that people will not lose their school year as a result of COVID-19. Doesn't mean the kids can't and have got time off, but I think it's really important that parents realize that. But I think it's getting tougher for the Premier to make that kind of a decision. And in that respect, I absolutely agree with the Medical Officer of Health.
Just wondering, Madam Warden, if you had something to add to that question as well.
I would probably echo what Ed has said. I certainly don't envy those in higher positions than me in some of the decisions that they're going to have to make. But I do think that, it's a tough call. If schools can be brought back, I think that will be a surge for the economy for sure. But again, it would have to be, things would have to drastically change. And I think as each day and as each week goes on, that's a more difficult decision to have to make.
All right. Thank you very much, Madam Warden, Mr. Mayor, and Dr. Mackie. We have one last question in today's briefing. Dr. Mackie, this one is for you, and it comes from Scott Navarro at Rogers Television in London. And this relates to a story that's been in the news fairly recently about the idea of an antibody blood test being the difference. And the question that Scott has is around, is there an idea when an antibody blood test would be available in London and Middlesex County? And what is the difference between that kind of test and the tests that are currently being used now?
Yes, so the test that we use now is a test based on a swab of the nasopharynx. So basically, straight back at the back of the throat, but going through the nose to get there. And it tests using a PCR test that detects the genetic material of the virus. PCR tests are very, very sensitive, and it can pick up the, in some cases, it can actually pick up the case before symptoms develop. In any case, certainly within 24 hours to 48 hours of symptoms developing. The antibody blood test is obviously, they have to take blood, and the blood is analyzed, and it's useful more kind of looking back. The antibodies don't always develop early in the illness. It usually takes about a week to develop antibodies after you've become sick. And even at that point, with this coronavirus, we're seeing that some people have not developed antibodies a week out. Antibodies, of course, are the white blood cell components that fight infection in your blood, and they're crucial for helping us to recover from coronavirus. The availability of an antibody test would be interesting. It would be helpful, mainly for clinicians and for patients to know what they had. It's not a very sensitive early test. So in terms of public health goals of identifying cases early so that they're not spread to other people, it doesn't play a major role. The most useful, the most common way that antibody tests are used at a population level would be to determine how many people in the population have had an illness over a certain amount of time. So if we did a survey, say we got 1,000 blood draws from people across the region, we could then estimate how many of those people have been affected. But the antibody test lasts for longer. So even once you're cured of the illness, when the virus is gone from your body and the PCR test would be negative, your antibodies are still there. So it's more useful for looking back over a longer time period. In terms of when that will be available, there are federal approvals and then provincial funding. It's not clear to me at this point when that would be available.
All right, thank you very much, Dr. Mackie. The time has flown by. We're already at 2:30. I'd like to thank you, Dr. Mackie, Warden Burghardt-Jesson, and Mayor Holder for joining us again for our virtual media briefing. We'll be back tomorrow afternoon at 2 o'clock, and we look forward to seeing you then. Thank you for joining us today.
Thank you.